Hi, I'm Dr. Alan Bulbin, Director of Infectious Disease at St. Francis Hospital in New York. I'm here with Ask Me Anything about CABENUVA.
CABENUVA is for virologically suppressed adults and adolescents with HIV-1 who meet certain requirements. See full indication on screen. It is contraindicated in patients with a previous hypersensitivity reaction to cabotegravir or rilpivirine and in patients receiving the medications listed here. Please watch the entire video for additional important safety information. Please click the link to view the prescribing information for CABENUVA.
Welcome. Let's get into the first question. Have the treatment goals for your patients living with HIV changed over the last decade? Yes, I would think, in fact, their goals have changed. Going back a decade ago, it was very much still all about getting patients suppressed, virologically suppressed. And once we've achieved that, then it's all about maintaining that. My next goal is to help them move forward in their treatment journey and take the next step together. This means I'm thinking of factors like treatment preferences, polypharmacy, and longer-acting innovations that could fit into my patients' lifestyles. Okay, let's get into question 2. How does CABENUVA align with evolving treatment goals? Well, I think CABENUVA aligns really well. I think a long-acting injectable like CABENUVA is a natural progression for some patients. As their treatment needs evolved, it's TAF-free, TDF, abacavir-free. So a 2-drug regimen that's injectable over 2 months certainly aligns with a lot of our patient goals. Okay, third and final question. Why do you prescribe CABENUVA? We always have felt a great sense of pride when it comes to being able to provide great options for our patients. I have a very broad mixed group of patients, from newly diagnosed to long-standing patients who I've known for now over 30 years. So diverse in that sense, new, young, old, male, female. I think it's adapting to the various needs of those various groups. I think CABENUVA fits into that very well, whether it's early in their course or even much later. Thank you for joining me, and don't forget to check out other Ask Me Anything videos about CABENUVA.
Warnings and precautions. Hypersensitivity reactions. Serious or severe hypersensitivity reactions, including Stevens-Johnson syndrome, toxic epidermal necrolysis, and drug reaction with eosinophilia and systemic symptoms, or DRESS, have been reported with CABENUVA or its components. Some skin reactions were accompanied by symptoms such as fever. Other skin reactions were associated with organ dysfunctions. Oral lead-in may be administered prior to administration of CABENUVA to help identify patients who may be at risk for a hypersensitivity reaction. If a hypersensitivity reaction is suspected, CABENUVA should be discontinued immediately and the patient should be monitored. Post-injection reactions. In clinical trials, serious post-injection reactions, such as those shown here, were reported in less than 1% of subjects within minutes after the injection of rilpivirine. These events may have been a result of accidental IV administration and began to resolve within a few minutes after the injection. It is important to carefully follow the instructions for use and observe patients for approximately 10 minutes after the injection. If a post-injection reaction occurs, monitor and treat as clinically indicated. Hepatotoxicity. Hepatic adverse events have been reported in patients receiving cabotegravir or rilpivirine with or without pre-existing hepatic disease or identifiable risk factors. Patients with underlying liver disease prior to treatment may be at increased risk with CABENUVA. Hepatic monitoring is recommended and discontinue if hepatotoxicity is suspected. Depressive disorders. Depressive disorders have been reported with CABENUVA or the individual components. Promptly evaluate patients with depressive symptoms. Risk of adverse reactions or loss of virologic response due to drug interactions. Adverse reactions or loss of virologic response due to drug interactions with concomitant use of CABENUVA may occur. Use with caution in combination with drugs with a known risk of torsade de pointes. Long-acting properties and potential associated risks with CABENUVA. Residual cabotegravir and rilpivirine concentrations may remain in the systemic circulation for up to 12 months or longer. Non-adherence to injections could lead to loss of virologic response and development of resistance. It is important to initiate a fully suppressive regimen no later than 1 month after the final injection doses of CABENUVA when dosed once monthly, and no later than 2 months after the final injections of CABENUVA when dosed every 2 months. If virologic failure is suspected, switch the patient to an alternative regimen as soon as possible. Adverse reactions. The most common adverse drug reactions were injection site reactions, pyrexia, fatigue, headache, and those listed here. Drug interactions. For important drug interaction information, refer to the full prescribing information for CABENUVA, vocabulary for oral cabotegravir, and Adurant for oral rilpivirine. It is not recommended to co-administer CABENUVA with other antiretrovirals. Drugs that are strong inducers of UGT1A1 or UGT1A9 are expected to decrease the plasma concentrations of cabotegravir. Drugs that induce or inhibit CYP3A may affect the plasma concentrations of rilpivirine. Use in specific populations. Assess the potential risks of using CABENUVA during conception, pregnancy, and while breastfeeding. Please click the link to view the full prescribing information for CABENUVA.